We are live.
Welcome, everyone. I see that some folks are still joining, so we'll wait just a couple more minutes to get everybody a chance to get in the session and loading into Zoom. Okay, welcome everyone. I'm very pleased to kick off our session this afternoon, focused on using positive behavior support during the COVID-19 outbreak to facilitate homeschool support for families around mental health and academics. I'm Andy Garbitz. I'm at the University of Wisconsin-Madison. I'm pleased to be here with all of you, as well as the other co-presenters, Mark Wiest and Jen Hoskins. I first want to address a few features of our virtual session. This slide is probably now familiar to many of you. On this slide, you'll see depicted expectations for the chat and polls. Please feel free to engage with us and each other during the course of today's session in ways that are topical and focused on our theme. You can use the chat to engage with other participants, share thoughts, questions, wonderings with each other and with us. We'll be monitoring that chat as our session proceeds today so that we can address and have conversation about some of the thoughts that you add to the chat. You can also find the Q&A under polls. Feel free to add any questions that you have specifically for presenters in response to the question and answer poll. We'll compile those questions and comments and share and address them during some of the discussion components of today's session. If you happen to navigate away from our session today and you would like to return, you can always click the Join Meeting button to get back in. And if you need support at any time, you can always go to the Help Desk tab at the top of your screen within Pathable. Our session today is part of the Family and Student Voice strand. If you didn't get a chance to view the other two sessions in this strand earlier today, you can review the recordings within Pathable. Just navigate to those sessions and then you can see those displayed there. Here are a few guiding questions that you might consider during this session. For example, you might think about how the topics we share today compare to your priorities and how you would align and integrate aspects of family-centeredness and family-school collaboration within your existing school-wide or community-based systems. So now I'll transition back to our session, which again will focus on using positive viewer support during the COVID-19 outbreak to facilitate homeschool support for families around mental health and academics. Here are our learning objectives for the session. At the conclusion of today's session, we hope that you'll understand more about family-centered and family school practices, be able to describe family strengths and needs during the COVID-19 outbreak, and explain proactive and positive approaches to support families and strengthen homeschool connections. This slide provides an overview of where we're headed today. I'll start out by sharing a bit more about family-centeredness in positive behavior support, as well as connections to positive behavioral interventions and supports. I'll describe one approach that we've used within the context of a positive behavior support or PBIS framework called the family checkup. Next, I'll describe some needs parents or caregivers have shared with us during the COVID-19 outbreak as we've worked directly with them to provide support at home and support and connections across the homeschool interface. We'll also talk about building strengths in supporting parents or caregivers and aligning positive behavior support across home and school. Finally, we'll describe strengthening capacity of a behavioral health community and involving stakeholders to drive those advancements. So I just want to start out by describing a few key definitions to sort of set the frame for what we'll be describing during the rest of our session today. One concept that we'll be talking a lot about is family-centeredness. As we describe family-centeredness, we emphasize a focus on strengths and empowerment within families to support families in achieving their goals. Thus, we focus on centering on family voice and empowering families to collaborate with teachers. We also emphasize school and educator capacity building to enhance their ability to collaborate with families. We find that when these elements are in place, we can help improve cultural responsiveness, cross-setting continuity, and collaboration. There are many ways that we can collaborate with families within the PBIS framework, such as by enhancing collaboration on PBIS teams, supporting the development of positive behavior support actions, and sharing strategies to promote effective home learning environments. As we consider ways to support families in using positive behavior support at home, we focus on understanding family goals and values, supporting families in achieving their goals for their child at home and at school by building on their strengths and sharing and coordinating efforts for schooling during learning activities at home and in the community. One approach or general framework that we've found particularly useful to guide our work with families is called the family checkup. The family checkup focuses on family-centered prevention and includes an initial interview, an ecological assessment, and a feedback session. During the feedback session, family consultants talk with families about different supports they can implement to address their goals. The family checkup then includes tailored support to families based on their needs and risk, including support for parenting, home to school planning, and academic and behavior support at home and at school. The family checkup can be implemented within the context of a PBIS framework. As depicted here, this figure shows how the family checkup can be implemented at Tier 3 as part of the PBIS framework with embedded family-centered and family school components at Tier 1 and 2, such as through proactive and positive communication at Tier 1 and enhanced family collaboration in check-in, check-out at Tier 2. In the family checkup, the initial interview includes a discussion about parents' goals and concerns. The initial interview also establishes a collaborative tone for future meetings. During the initial interview, we really seek to understand parents' motivation to change by discussing their strengths, their concerns, parenting strategies, and child behavior. We also focus on straightforward communication systems that make it easy and reinforcing for families to interact with their family consultant and other relevant providers, such as teachers and mental health professionals. The ecological assessment includes assessing relevant dimensions of family and child ecologies. So we want to understand how families are managing their home environment, what background and support families have, as well as things like child adjustment. During the feedback session, family consultants discuss the assessment information with families, which is depicted on a rainbow sheet, such as the example here about family functioning. Family consultants then talk with families about different supports they can implement to address their goals. And then we'll also implement follow-up sessions, which are collaborative and provide additional, brief, and targeted support based on parent goals. Support from studies that have examined the family checkup have consistently shown that engagement in the family checkup is linked to reductions in student emotional and behavior problems, family conflict, and substance use, as well as increases in effective parenting strategies and school engagement. In fact, we see that the family checkup enhances and supports parenting skills, which then precipitate reductions in later risk behavior, promote positive school achievement, and improved self-regulation. We were in the midst of implementing the family checkup with several families in the context of a larger project as the COVID-19 outbreak occurred. In response, we asked families to share their experiences. In our sample of families, about 21% experienced job loss very soon after the COVID-19 outbreak started. Families shared with us that their greatest concerns in navigating the COVID-19 outbreak included their child's academics and mental health. You'll find in Pathable a poll. We're interested in understanding your experiences with families. When you've interacted with families during the COVID-19 outbreak, what are the most pressing issues on their minds? So you can find the poll to answer this question in Pathable. So as we transition to Jen, I just want to take a moment to acknowledge our larger team who couldn't all be here with us today. Of course, this work would not be possible in our larger work with families without this committed and collaborative team. We certainly acknowledge their significant collaboration as well as support from the Institute of Education Sciences. So I'll now turn it over to Jen, where she will share more specifically about her experiences directly supporting families using the family checkup during the COVID-19 outbreak.
Thanks so much, Andy. I'm so excited to talk to you all today about the work I'm fortunate to do with families. And I'm really appreciative of Andy inviting me to be a part of this presentation because it provided this opportunity to tap the brakes and pause and reflect on the work that I've been doing. It's interesting because I'm going to be talking to you about doing this work with families during COVID. And I think sometimes I even use past tense language in my presentation, but the truth is I'm right in the middle of doing this work with families. Just as all of you likely are across the country, Oregon is still deep into this and our kiddos are getting their education at home. And just this morning I met with a family. So we're really in this work right now. I want to tell you a little bit about myself so that you can have some context for the way I work with families and my clinical lens of perspective. So I am a social worker and a family consultant at the University of Oregon's Child and Family Center. But first, I was a parent to 6 children, and then in addition, became a social worker. I actually didn't take my first college class until I was 32, and I'm 41. So I'm telling you this so you can understand actually how new I am to the field of social work. I did my undergrad, and then I went to graduate school. I did a fellowship at the Child Development and Rehabilitation Center at Oregon Health and Science University, where I was working with kiddos with developmental disability and their families. And then I came to the University of Oregon. My clinical interests are really at this intersection of developmental disability and intellectual disability and mental health needs. And I'm really interested in expanding services to families who experience that intersection. And I hold a specialist certification through NADD in diagnosing and providing services to folks with IDD and mental health needs. But really, I have actually spent far more time as a parent of kiddos accessing services and supports and meeting my children's specific needs than I have as a provider providing services to parents. And that really informs the work that I do. When one of my children was quite a bit younger and in elementary school, he kind of took a waving developmental path. It weaved in and out. And he was really struggling with having accidents at school. And I was there with him. I think I had a big pregnant belly and probably a few toddlers in tow, and I was very young. And I was kneeling down with my kiddo and trying to motivate him to feel the courage to be able to go back into the classroom. And I remember thinking, this child and our family are so much more than this moment in time. And I think about that a lot with the families I work with, that whatever moment we're having, they are so much more than this moment. Andy, can you go ahead and change slides for me? Thank you. So Andy gave a great introduction to the family checkup. I'm just going to give a brief refresher to remind you of the work that I do. So I use the family checkup model working with families. It's an evidence-based practice developed at the Prevention Science Institute at the University of Oregon. It is very strength-centered and family-focused. I like to think of it as a social, emotional, family well-being visit, kind of like going to the pediatrician and getting a well child visit. And then it's paired with individualized follow-up and support, really being guided by the family's desires and goals. Go ahead and change slides, Andy. Thank you. So I was working on this project, working with families through a federally funded research grant using the family checkup model. And we were focusing on children and families where the children was transitioning into middle school, so fifth graders. And that's still the project I'm deep into. And at first, before COVID-19, we were meeting with families in person, typically in their family home, but also in their school settings or community locations like libraries. And the great thing about the family checkup is it provides these opportunities for tremendous clinical flexibility. So I do the initial interview with the family. They fill out some questionnaires and surveys, and I do some work to present this package to them about what's going on with them as a family. And then together, partnered with the parent, we get to set goals and really listen to what their needs and desires are and provide follow-up support based on the things they would like to be doing with their child. Because this is a federally funded research grant, I don't worry about diagnoses. I'm not having to worry about insurance. And I can just really provide the level of support that the child needs and the family desires. Family checkup is very rooted in the idea that the parents and the family are the experts on their experience. And I really do try to follow these families' lead. Go ahead, Andy, change slides. Okay, so I was right in the middle of doing this project. And then, like all of you, I had to suddenly transition to a virtual model. So our in-home services were put on pause on March 16th, 2020, due to COVID-19. And the very first thing we did actually that afternoon and that week was to check in with every family by phone. And then we used a tiered system approach to work with our families moving forward. We determined what universal, targeted, and intensive supports our families desired and needed and what we could provide in this moment. And for the first few months of this, we were doing most of that using phone and text. Because we were not using insurance and we didn't have to get approval in that way, we were able to instantly serve families and partner with them. Go ahead and change slides, Andy. So I thought I would tell you a little bit about the universal supports that we offered, and then the targeted, and then the intensive supports. So the first thing, oh, and the important word is offered. So we came together as a team and talked about what we realistically could provide families. And then when I'm talking with families, I offer these things up. And then families choose to engage with them in the way that works best for them. And sometimes we're tweaking this a little bit to make sure we're following the family's needs and listening to their desires. So at the universal level, we were providing every family a monthly check-in call. And then we invited them to be signed up for the family checkup online. This is a tool that was created at the University of Oregon. It provides fantastic parenting support through an online module that's self-directed. So a parent could be up at 11 o'clock at night after the kids are to bed, and they could go in and think about, like, how could I develop a reward system, or how could I create some limit setting around screen time? And they can do that on their own. So every family was offered that. Every family was offered an invitation to receive our family checkup twice monthly newsletter. Now, I'm going to be honest with you. The family checkup twice monthly newsletter was developed on March 16th, the day we closed down from doing family services and moved to a virtual model. We had research assistants that just dived into what are the community needs here in the Portland metro area, what are our families asking for when we're doing these check-in calls. And we started creating a beautiful one-page newsletter that gave them really relevant, up to the moment information every other week. And the way I used it as a clinician is if I did a check-in call with a family and they said, hey, we'd really like an affordable way to start a garden with our kids, I'd reach out to our research assistants and say, hey, can we put some gardening tools in the newsletter? And then I'd send a text to the family and say, check out the newsletter that just got emailed to you. There's some gardening information in it. Always in every contact we were having with families, whether it was through our newsletter or these monthly check-in calls, or even through the family checkup online, we made sure that our information for all our family consultants was available, our phone, our text, our email, so families could connect with them. And then one last thing we did for every family is a handwritten card. Now, that's kind of an old-fashioned thing. I prefer email, but we talked as a team and we realized our families were being bombarded with virtual technology. And what they had lost was us coming into their homes and really meeting them where they were at in that very personal, tangible way. And so by writing them a handwritten card and telling them the strengths that we see in them, we were able to kind of come into their home in a different personal way. Go ahead and change slides, Andy. So the targeted supports that we offered, fewer families were, they basically got all of the universal supports and then these additional supports. And this would have been families that we talked to who maybe were a little bit more risk of having a hard time during this, or communicated to us that they were worried about how their kiddo would react to online schooling, or they were concerned about finances or health. These families got a second call a month. So we did twice monthly check-in calls with these families. We also connected them with community partners and resources, gave them the information that they needed to seek out the supports they needed. And we offered some individualized parenting support over things like routines or using telehealth, online school, screen time concerns, that one came up a lot, and supporting the big emotions for both the grown-ups and the kids. This might have happened during the twice weekly phone calls or over text, or even sending a text to a parent and pointing them to something to look at on our family checkup online that might help them out. Go ahead and hit the next slide. So our intensive supports, this was offered to much fewer families. They were families that were having, as you can imagine, a more intense experience with COVID-19. And those families received all of the universal supports, all of the targeted supports, but we might have been checking in with them weekly. Or in the case of one parent I was working with in the initial first few weeks, we were having a chat on the phone 2 to 3 times a week. And the reason for that was this parent had been very dialed into mental health supports and was receiving a lot of support from their community mental health provider. But in the first few weeks of the shutdown in Oregon in March, many of our community mental health providers had to put a lot of things in place before they could provide support to folks. And so as a family consultant and social worker, I stepped in and provided that bridge and provided that intensive support until those community mental health supports were able to get up online. I also provided side-by-side virtual assistance with accessing supports in the community. So that might have looked like talking someone through on the phone how to figure out how to sign up for a community program, and we might fill the application out together. We might using three-way calling, call the community support and navigate it together. I also provided a lot of mental health support and crisis intervention to folks. And then at the request of families and following their lead, I worked with their other support systems to navigate challenging situations. And that might have looked like working with a school teacher, working with a school counselor, working with a mental health counselor to make sure that we're tackling some pretty serious issues that were magnified with the stress of COVID-19. Go ahead and change slides, Andy. All right. So I want to chat with you a little bit about the lessons that I've learned in this moment. Like I said, I'm still really deeply into providing supports to families during COVID-19, and my own family is really deeply into it. While I'm talking to you right now, I have 5 kids taking Zoom classes with public school just right outside the door in our little house. But what I've seen in the last 6 to 7 months that's been interesting to me is that families moved up and down the tiered systems of support a little bit more rapidly than I would have expected. What that looked like is I might have done a monthly check-in call with a family in March, and things looked really good. They felt like they had a game plan. And then I'd call in April and a parent lost a job, and we had families who got the COVID-19 virus. And suddenly things, maybe they needed some more targeted or even intensive supports. I also had families that were in the intensive support part because their other community providers were scrambling to get things in place. But then when those community partners had everything in place, things stabilized and families moved back down to maybe more targeted or universal support. I also learned and am continually learning that flexibility is key. It's important that I'm flexible in my work. I'm flexible with the way families change, that I might text them on one day and things feel really good. An hour later, things don't feel really good. I'm sure you've all experienced this, that, I'm noticing a question and I'll get to that. What I experienced with parents is things changed a lot. So somebody asked, did we determine their tier of support in the initial interview? And we did initially do that when we first made those calls to families. But then, as I said, folks shifted up and down. And so we were maybe moving someone into a more intensive level of support than I expected. And I also learned to embrace newness with all of this. So there were lots of new challenges, right? I remember in March thinking, wow, COVID-19, it's like the biggest thing that's happened in my lifetime. But then there was the economy. And then for folks in Oregon and California and other parts of the country, there was wildfires. And so I had to think about a lot of different delivery models and how I could meet families with the restrictions that we had and their needs. I did a tremendous level and continue to do crisis intervention over text, because families were, for example, evacuating their house due to wildfire, and it was just easier for them to communicate with me over text. Another thing that I did is I really moved to working hours that are very flexible. That obviously served me as a parent, but also what I found was, even though I was working from home, parents are also at home with their kids. Their kids are being educated. And so sometimes a traditional hour to reach out to a parent just didn't work. And so I meet with parents on Saturday mornings and Sunday afternoons and 9 p.m. on a Friday. I'm not working 24 hours a day, though sometimes I feel like I am. But instead, I am maybe meeting with a family on a Friday night at 9 p.m., but giving myself space to support my own children in the middle of the day. Another thing that I learned was to provide relevant support during a crisis. So I'm trained in mental health, I'm trained in the family checkup model and motivational interviewing, but I have also spent a lot of time finding hotel spaces for wildfire evacuees. I've learned the ins and outs of the stimulus package back in April so I could help a family get the needed funds to keep them in their home. And recently I've been tracking down internet hotspots for my families that live in more rural communities who don't have appropriate internet available to them in their home. So these are a lot of things that I've learned, but if I were to say there was one thing that has been most significant to me in the last 6 to 7 months, is that my best tool as a provider is a clear understanding of the family's specific strengths. So it's really important that I know that this child and these parents and this family situation, they are so much more than the moment that we are in, and that I can describe what makes them so much more than this moment that we are in. All right, Andy, go ahead and move slides, and I'm going to take a look at some of the questions that are coming up to make sure I'm reaching them. All right, so one of the questions we have is this something teachers can do, or do you recommend to be a social worker or a counselor? So there is a clinical aspect to it, and so it seems to be something that's rooted in mental health, but we can chat about that more because I think it is something that can definitely be used in the school system with the support of teachers. So we're going to shift to a discussion where I can keep answering more questions, and I've got some prompts for you all. What new skills have you learned during the COVID-19 outbreak that could be applied to working with families within a PBIS framework? And based on what you have learned during this time, what new options do you have for supporting families? So go ahead and share your thoughts there, and I am going to take a look at what's popping up and see if I can help out. All right, so folks were asking me, was there a motivational interviewing survey? I'm going to touch on that a little bit more coming up, but we do an interview and we do have a questionnaire families use, and I definitely use motivational interviewing in my initial interview and in the survey. I'm even going to share with you the exact questions that I use to learn about strengths from families. All right, so another person asked, considering how quickly families' needs may change, are there particular data or strategies you recommend using to identify and respond to those who need more support? Well, I'm sure you're probably hoping I give you something a lot more complicated, but listening is so important. There were times when I was on the phone with families where the first like 10 minutes, the parents would respond to saying, you know, everything's fine, everything's good. And we'd sit there a little bit longer, and then they were able to feel safe enough to say what isn't going well and what's really challenging for them. I also think that when we meet people through an empowerment lens and we ask them what their goals are, they reveal what their needs are in that, but through an empowered framework. Let's see. How does the family checkup compare to wraparound in terms of use and training? So I would say wraparound is a little bit different. I would say wraparound is a model that a lot of my social worker peers use. And as a family checkup, family consultant, I would join in with a wraparound team and be supportive to the family in that way. So as a family consultant, I frequently partner with a lot of other services. I don't take the place of other services. So I'd be a member of the wraparound team. So can I see, let me see, Darian, sorry. I'm navigating both screens and I want to make sure I'm seeing everything that y'all are asking.
I just wanted to make sure you were able to see their responses to your prompt about the new skills they've learned. If not, I can summarize some of those.
Yeah, could you summarize them? Because what I'm seeing coming through my chat, but it's changing really quickly,
Okay.
doesn't necessarily respond to that. So tell me, Darian, I want to hear it.
Brevity is a new skill they've learned. Someone shared that they've created an online self-care center that students and parents are invited to join, and they suggest topics that haven't been added yet. Pacing, focusing on self-care and meditation and organizational tools, playfulness, acceptance, curiosity, and empathy, using text to communicate with parents, giving grace and providing self-care tools, flexibility. Let's see.
Oh my gosh, Darian. So Devin, what I'm hearing is that we have a lot of providers on here that are really meeting parents where they're at, really understanding the stress folks are under. I love the idea of focusing on self-care techniques with families. Y'all are doing exciting work. So someone made a comment that they liked the idea of the handwritten cards because it shows that we took some extra time. And I do think there is like that kind of old-fashioned component of like, you really took the time to write this. And we also, like I said before, just felt like it was an entry point for us to enter their homes. Someone asked me how we navigate the language barrier. So this is a really important question. I have a colleague who's another family consultant. She is our bilingual Spanish speaking family consultant. So she does all of her work with families speaking Spanish to them, for our families who speak Spanish. For this research project, we are working with families whose primary language is English and Spanish. So I do all of my work in English, and my colleague does work in English and Spanish. But I will say, as a medical social worker, I partnered with interpreters. I think that it's extremely important that we bring in skilled interpreters to support families' language needs, to ensure that they're understanding everything we're presenting to them and have access to the most accurate information when we're working with them. All right, looking. Oh, I love the idea of grace. I'm going to talk about that coming up in just a little bit, that we really have to extend patience and grace to ourselves and our colleagues and to families. Someone mentioned a Schoolology course. That's fantastic. Focusing on the importance of teamwork and family needs. Yeah. All hands on deck mindset. Oh, someone asked, does anyone have experience with self-care directed at teaching staff? Yeah, I think it is so important that these principles that we're extending to our parents and our children, that we're taking the time and space to extend them to ourselves and our colleagues, because we are all experiencing this together. And many of you are like me, where you are not only providing services to others, but supporting your own children and maybe accessing services. So we're wearing a lot of hats. All right, Andy, I think we can move on to the next slide. I want to thank everyone for the things that they've shared, and continue to throw things in the chat room, because we learn so much from each other, and any good idea I've gotten has been because someone else shared it with me. So as I said before, the biggest thing that I learned was to go with strengths. And I think we have to be really intentional about this. I was on a research project a few years ago where I had the opportunity to read IEPs for high school age kiddos. And it struck me how many of them had the exact same strength written into their IEP. It was frequently like full of humor and big smile. And when I'm talking about strengths, I'm saying let's dig a lot deeper and be really intentional about this. So Family Checkup uses motivational interviewing. and which focuses on the person's strengths as their tool to be able to make change. So we talk about when they've had success making change in the past, and we treat them as an expert on their experience. So one of the things that has become foundational to my clinical work is choosing to believe families and seeing them as true experts and leaning into their capabilities. So motivational interviewing, which, as I said, is what Family Checkup is rooted in. It was developed by Milner and Rolnick in the 70s, these two researchers who were focused on addiction. And if you read the book Motivational Interviewing, there's an area in it where they talk about naive gullibility as a character strength of a therapist. And it really struck me because as a social worker, my experience has been folks come to get me when there's a problem. And so I enter the space through the problem point, and that is defining the family in that moment. But really, when we consciously choose to enter through a family's strengths and to really believe them, lean into it, and follow their lead, that's where trust happens. And so in the way we do the family checkup, when I'm meeting with parents, we do that initial interview. We do a survey when we ask them to fill things out. So you could think of this a lot like when you're in the pediatrician's office with your kiddo and you're filling out things that are going on with them. We do that. And then when I sit down to meet with a family, part of my packet that I give the parents for this family checkup is that I present them with 3 strengths that I've learned about them, and they're very specific. I talk to them about, you told me this in your survey, and here's a strength that I'm seeing in your family. And we actually present these strengths to the family in a way that they can put them up maybe on a refrigerator in their house, but we also present them what we call the pocket strengths. And this was actually an idea of one of our researchers. We'd been talking about how we wanted to make sure that we clearly and specifically talk to families about the beautiful strengths we saw in them. And she said to me, oh my gosh, I could use this, but I need to be able to like pull it out of my purse when the school calls about my kiddo so I can remind myself that I'm okay. And we were like, aha, we need to make this in a pocket portable form so families can take it with them. So we also present them their strengths in a pocket form that they can put maybe in their cell phone cover or in a wallet or a purse or pin up in their office. And so already before COVID-19 happened, my work was requiring me to really dig deep into folks' strengths. And so then I turned to those strengths to figure out what tools the families had to navigate their different crises. And I would say, if you're short on time with a family, focus on their strengths, because that's where the information is that you're going to need to collaborate with them moving forward. Go ahead, Andy, and change slides. All right, so I wanted to give you some tangible stuff. And we do this initial interview. We ask a lot of questions in the initial interview, but there are some specific ones that are in there that are intentional so that we can dig down to these awesome strengths all these families have. And so I put up a list of the different questions that I use. We might ask, who means family for you and your child? And that's where we discover wonderful support systems. Who means community for your child and family and you? And we learn all these extra folks that are invested in this family. What is important, culturally significant, or centering for your family? And this can be the religious activities, traditions, passions, ideas, hobbies. One family told me, you know what, they were stuck for a minute, and then they said, oh, we're always working on the house together. That's something that we do together that's really centering for us. But this 4th question down, this has been such a power question for me when I'm doing interviews with parents. And that is, what is the most joyful part of the day for you and your child? I have found that this one gives me so much great information. Parents will tell me about a routine that's going well for them. They'll tell me about a favorite meal that they have with their child. They'll tell me about the fun things that they do or the music that they listen to. And in there is just fantastic information. I might ask them about routines that are going well, what their future hopes are for their child. When they're thinking about setting goals, what comes to mind? I always ask how they best like to take in information. And I mean that for their kiddo and for the parent. And then I try to ask too, what's something I can do to make your time together meaningful for you? So one of the things that I have learned as a parent accessing services is that even though maybe utilizing a service can be stigmatized, it doesn't have to be that way. Some of my really happy memories with my children in their school community has been with service providers who have just done tremendous work making something that seems hard feel really beautiful, to make us feel included, to build community for us. And so these services we're providing for parents, whether they're at universal or targeted or intensive, they can be meaningful and positive and joyful memories for folks, even during really challenging times. Okay, so I hope you're all listening because I saved one magic question for you. This question, I try to ask parents every time I talk to them. And I didn't invent this question. Another clinician at the University of Oregon shared this magic tool with me, and I've been amazed at what it's done. So when I'm talking to parents on the phone or over text, whether it's an initial interview, follow-up visit, the family checkup visit, I listen really clearly for them to tell me about something positive they're doing. And then I ask them this in one form. I'm going to give you a couple forms of it. I'll say, who taught you that? Or where did you learn that? Where did that come from? And that seems like such a simple thing, but it just cracks open families. And they begin to tell you about their resilience. They tell you about their support systems and their culture. They'll tell you about their successes. And you begin to thread this storyline where you see families where they're at and all the beautiful things they do to overcome barriers. And you have so much more information about what they have at their disposal to overcome the next barrier. So that is the magic question. Try to ask it as much as you can. Okay, Andy, go ahead and change slides. So I'm sticking with the strengths thing. This is truly what I think is so important. And I think sometimes we have to be really courageous to stick with strengths because it feels like the fluffy part of the work. So I said before that as a social worker, we often are brought in when it's a problem. If as a social worker, when I've done diagnosing, you're supposed to identify the problem. And so when I have talked about this with my peers, they're often like, oh yeah, that sounds really great, but you do focus on the problems, don't you? And there's this concern that maybe I'm not doing the work if I'm really focusing on the strengths, but I want to ask that you take a risk and you focus on those strengths for the child, for the family, and the grown-up, and see where that takes you. Okay, I got a question. I'm going to read it real quick so I can see how it can help. Okay, so the ecological assessment or survey that we use to learn about families. So the one that I am using in my work is actually a research survey that we use for this research project to get data. But I do know that the Child and Family Center at the University of Oregon in Eugene, at their clinic, they have surveys that they use as well. And I can look into seeing how easily accessible those are. But the surveys ask a myriad of questions about what's going on in the family home. And then we honor what the parents say. So when I'm talking to parents, I'll say, you reported that this is happening. And then I follow that up with, does that feel accurate to you? And we make sure that they know that if it doesn't feel accurate, if the way I interpreted the way they answered the survey doesn't feel right or accurate, we can move around on that rainbow sheet that Andy showed you where the family falls, and we can change it all the time because again, we're honoring them and following their lead. Devin is saying that the FCU materials, she has access to them, and so individuals can contact her about that. So reach out to Devin. Thank you so much, Devin.
Oh, Andy, do you want to clarify?
Sure. So yeah, if you are interested in some of those ecological assessment information and ways to learn more about families, feel free to send me a message, and I can share more about some of that information too, and some forms or other kind of materials that you might be able to use in your work. And I think my email is included in the chat and things.
Awesome. So yeah, correction, reach out to Andy, not Devin. Sorry, I'm trying to read all the different chats and I get myself confused a little bit. A question is, do I meet with parents alone at any time, or are the children always present? That's a fantastic question. We do what serves the family best. When I call and talk to the parent, I'm very transparent about what the whole process looks like. Recently, around 8:30 last Wednesday night, I did an initial interview with a mom. And when I asked her what would be most meaningful for her, she said, my daughter has loved being involved in this project, and she would like to be included in all of the family checkup things that we do. Can we make sure we schedule it so she can be included? And of course, we're going to do that. Other parents have said, there's things and goals I want to talk about that I think it may not be a good fit for my kiddo to always be included. And again, we trust them and follow their lead. There's tremendous flexibility around that. All right, so I just want to highlight some of the things that I learned. Yes, we can. So some of the things that I learned about this is by following folks' strengths. All of these families on here that have these different strengths that I've listed, in other environments, their problems would have been highlighted as being quite intense. But there were these surface strengths that really have proven to serve them well during COVID. All right, Andy, go ahead and change slides. All right, so I'm going to give you a discussion prompt. We're not going to spend much time answering them here because we have some question and answer at the end of this. But if you want to get going on putting things in the chat box, that would be great. The prompts are: what strategies have worked well for you in identifying family strengths? What are your strengths working with families? Because we're not going to be great at finding the strengths in others if we're not able to recognize them in ourselves. So I want to hear what your strengths are. And what strengths have you seen in your workplace that could be magnified to serve families? So get going on that, throw stuff up in the chat box for each other. And Andy, go ahead and change slides. All right, so I just want to offer you a few nuggets around homeschool and community connections based on my experience. So I think in order to build homeschool and community connections, we need to provide many diverse entry points for services. And so I hope that one thing that comes out of COVID-19, perhaps an unintended opportunity or silver lining, is that virtual access might be more available to families. I would say be patient, and then be a little more patient with yourself, with your colleagues, with your community partners, with the children you serve and their parents. I would say participate in community collaboration meetings. Instead of having redundant work, connect with each other. Every community has tremendous assets, and we need to tap into them to serve families. And then I just want to end on following the parents' lead. Buy-in really matters, and there's so many ways to do something right. So I would hope that when you're sitting down with families, you would look at them and you would say, this child and this family is so much more than this moment. All right, I'm going to turn it over to Andy.
Thank you, Jen, for that great information that you shared. We're continuing on with our session now, and just wanted to add a few points as a connection opportunity from Jen's really important content. I think, some themes that I have been reflecting on, Jen, as you've just been talking, is, this importance of really centering on relationships, including families as equal partners in the decision making, and then considering consistencies and creating across, home learning learning and informal family interactions, and also including thinking about that broader family system, and really centering and focusing on family well-being. So thank you, Jen, again for that really important session. I'm very pleased now for us to transition to Mark Wiest. Thank you, Mark, and please take that.
Outstanding. Thank you, Andy and Jen, for the really terrific presentations. Some of you know that Andy, Devin, Jen, and I connect to a group called the Family School Community Alliance, which is really about dramatically changing the paradigm. Families in general are not really involved in schools. Youth are not really involved in shaping the environment of schools. We have to totally change the paradigm as reflected in the strand today. There's a new funder that started fairly new around 2008 called PCORI, the Patient-Centered Outcomes Research Institute. And it has kind of a similar motive, that is totally change the paradigm of healthcare so that it's not just driven by the experts, but that consumers, patients actually have a strong voice in improving healthcare and improving research on healthcare. So we've been very fortunate to have a connection to PCORI. It was established as part of President Obama's Affordable Care Act and was just reauthorized for another 10 years. So we're very, very excited. Many of you may not know about PCORI, but it's really a terrific resource. You could go to the next one, Andy. Thank you. So initially, there's a mechanism called a Eugene Washington Engagement Award. We have something here called the Southeastern School Behavioral Health Community. It actually started just in South Carolina. We've expanded to the Southeast related to support from this engagement award. And the award was all about, and we use the term school behavioral health to convey the mental health system joining with well-done multi-tiered systems of support as in PBIS. So we use the term school behavioral health to kind of summarize that. This award focused on understanding how can we strengthen school behavioral health in South Carolina and the Southeast region of the United States. Stakeholders helped us to identify 5 theme areas. You can see them there: school-wide approaches, quality and evidence-based practice, implementation support, family and stakeholder involvement, cultural humility, along with 3 priority populations: youth connecting to the military, to juvenile justice, and child welfare. And we held focus groups on each of those themes around South Carolina as part of this award between 2015 and 2017. Next. We qualitatively analyzed those focus groups. We actually have a book coming out on them. Darian, who's helping us with the talk, was a lead for us with that book. Of all the different focus groups, there were more than 100 themes identified. We went back and looked at all of the themes, and the 2 most prevalent themes are listed there. The first was that families and youth are tired of being talked down to. They're tired of not being communicated with. They're tired of not being collaborators. What we need, they said, was equal family, school, mental health system collaboration. And the second was that stigma is very pervasive and is the most prominent reason why people don't seek mental health services. You can go to the next. So findings from that smaller grant from PCORI led us to develop an application for a large randomized trial that's going on now. It's called the Partnering for Student Wellness Study. It's a randomized controlled trial operating in 20 middle schools, 10 in Baltimore, 10 in Greenville, South Carolina, so very different environments. All 20 schools are receiving support for effective MTSS and effective intervention at Tier 3, including around family engagement, modular cognitive behavioral therapy, quality improvement, and implementation support. And then half of the schools, or 5 in each location, 5 in Baltimore and 5 in Greenville, are randomized to receive additional components that were recommended by the stakeholders. So this is a 3-year intervention versus comparison period and then another year of follow-up. So we're approaching about the halfway mark of the study. Please go to the next. Partnership intervention involves clinicians joining with teachers, one each from 6th, 7th, and 8th grade, joining with a school family leader to work together to enhance family and youth voice and leadership within the MTSS, to work with the MTSS team to increase stakeholder involvement and to implement these additional elements of emphasizing therapeutic alliance. And there's a system called the Patient-Centered Outcomes Management System to promote therapeutic alliance. And we know that much of the variance in whether people improve from mental health treatment is related to their perception of feeling allied with the helper or clinician. Providing mental health literacy training, and this is a really, really critical theme. I'm going to come back to it. And working also on bias reduction and equity enhancement throughout the MTSS. We're also using the ECHO model, the Extension for Community Healthcare Outcome System developed at the University of New Mexico and being implemented around the world to amplify innovation in healthcare, which we're excited to be part of the ECHO framework. Next. In searching for a mental health literacy intervention, we found this one and have a very close collaboration with Stan Kuchar and Ethan from Dalhousie University in Canada, the developers of this curriculum, which is likely the best mental health literacy curriculum in the world, being implemented around the world, but not in the US. There's only a few sites in the US implementing the guide, and we're the first randomized study involving the guide. And so we have teachers in classrooms delivering information to students about mental health challenges, how to seek help, how to promote mental health. Next. So as Jen indicated, March 16th, which is probably a significant date for most of us, we moved to virtual as of mid-March 2020. Both mental health centers and the collaborating school districts pivoted to telehealth and virtual learning with a mixed experience there. As everyone is encountering, there's positives and negatives. Virtual learning working well for some students, but not others. Telehealth working well for some students. For example, older students, telemental health with internalizing issues like depression, anxiety, trauma-related problems seem to be doing okay with the telehealth experience, but other students aren't, like younger children with attention problems, not doing well with the telemental health model. Actually, here we are now in mid-October. Baltimore, it remains all virtual, and Greenville is moving toward a hybrid model with in-person learning varying from 2 to 4 days per week, depending on the prevalence of the virus. If you could go to the next one. Maybe go back, Andy, I'm sorry. We're actually persevering. The study is continuing. We're very grateful to PCORI for continuing to support us. We obviously have challenges related to enrollment and some other things, but the study elements have continued, and we're actually learning that aspects of it, such as culturally responsive engagement, bias reduction, therapeutic alliance, mental health literacy, are really critical elements in these challenging times that we're living in. Next. A few weeks back, I was fortunate to attend a colloquium here by a local pediatrician, Deborah Greenhouse, who just highlighted, the challenges that we're experiencing. She also highlighted that we don't have a lot of empirical literature now on this, but it is increasing. The American Psychological Association just came out with a study documenting more than 80% of folks are really challenged by the current context, and it's beyond COVID-19. It's racial injustice, it's fires and natural disasters happening in some locations, it's political dysfunction, it's many other things. So it's a very, very challenging time, the most challenging time in all of our lives. Dr. Greenhouse emphasized there's widespread uncertainty, fear, pandemic fatigue. I was one of the optimistic ones that thought this would be behind us by now. And obviously, we still have quite a ways to go with this. There are particular increases in anxiety, depression, obsessive compulsive disorder, and eating disorders. Eating disorders working both ways with students with anorexia and binging and purging, but also students sitting in front of a computer and eating all day long. And Dr. Greenhouse, for example, provided her observation that she noticed some students gaining 20 pounds in a month, which is just a phenomenal amount of weight gain. So we also see increased mental health challenges, yet impeded access to mental health services, which is concerning. If you could go to the next one. Obviously, very significant socioeconomic impacts, and that's been discussed throughout the forum. Issues with unemployment, food insecurity, Wi-Fi issues, which we've been discussing the past 3 days, and tremendous disparities in access based on the local districts. So some of the districts here remain totally virtual, others are opening up, and for example, include five-day learning option. So there's a great disparity just based on your zip code. Virtual learning not working for many, and we're also seeing collateral damage of decreases in other medical care and immunizations. And other things happening that maybe we haven't thought about, such as gaps in resources that we used to depend on that now aren't available. So for example, around here, we would have drives to support children and families with school supplies, and those drives didn't happen. So the students don't have the school supplies that they would typically have. You can go to the next one. We had a discussion, we have something here called the Carolina Network for School Mental Health. Darian is one of our leaders of that. And a recent discussion just on the impacts, and here are some of the themes. Just federalism, which our team has been writing about for quite some time, states' rights, local control, has many advantages. Some of the challenges where we just see this tremendous variability in the way communities are handling the situation that we're in. This quote, "We're building the plane as we fly it," as school districts struggle to provide optimal learning environments for children in this new normal. Many staff being fearful. We're seeing elementary grades prioritized for in-person, that perhaps creates an inequity for the older students, middle and high school students. And this irony that communities of color, the data are showing, may be most affected by the virus. And in many cases, because of that, they're the most reticent for in-person school, but in-person school is associated with the most resources. So another challenge that we're dealing with. Next. However, there are positives. We're seeing an unprecedented level of collaboration within and across systems. We're breaking down all kinds of barriers related to telehealth and virtual learning. We're learning about benefits of virtual learning and hybrid strategies where we don't always need to be in person. So there are definitely some positive things occurring. So I believe we're going to transition into our general discussion. And if you could go to the next one. So that concludes our formal presentations, and Andy will come back on camera. Maybe Darian and Devin will as well, perhaps, and we can launch into a discussion period at 7 minutes. So Darian and Devin don't want to come on the camera. That's okay. Oh, there she is. Darian, do you have a discussion question for us?
Well, it looks like there's several in the chat that Devin has been compiling for us. So sort of looking at some of these, what do the logistics of carrying out some of this work look like at different schools, like between secondary and other levels?
Anybody want to take that? Jen, Andy?
I'm glad to take one try at it, and Jen, please jump in with your comments as well. In terms of aligning and integrating a family-centered approach within the context of PBIS, we really I'm glad to, kind of share with you some more about that as we proceed. But essentially, we really focus at Tier 1 in building on the PBIS framework, and believe that that set of systems and practices really serves as an effective vehicle or delivery system for centering on family and student voice, building in cohesive family-centered systems at Tier 1, such as proactive and positive contacts, including families in screening kinds of information, and then using that information at Tier 2 to invite families at the beginning of check-in, check-out to define how those set of practices carry forward, and then including families in key decision points along the way, and then allowing the family checkup to serve as a family-centered option at Tier 3 provides a nice continuum of services and options for family school connections in a way that really does center on families and their perspective, and includes families as co-equal decision makers from Tier 1 all the way up to Tier 3.
Yeah, I would echo what Andy says, and I would say, as someone providing direct service to families in the schools, the families that are in the project I'm working on, they were recruited when they were transitioning into kindergarten, and I'm working with them as they're making transitions into middle school. And because we center the work around following the parents' lead and honoring the strengths of the families and listening to them, I really think it's something that can support families at every level, from early intervention all the way up to transitioning to adulthood, because really we're there to support where the direction the family wants to go.
Excellent. Do you have another question for us, Darian?
Actually, what Jen said just led into another question. Considering how quickly families' needs may change, are there particular data or strategies you recommend using to identify and respond to those who need more supports?
Yeah, so I think this goes back to the idea of providing lots of entry points and connection points with parents, so that we can be available to hear their needs in the moment they're ready to share them. And so as community providers and as teams in schools, we need to be working real well together, and then be available and open to our parents, so that when the need arises, we hear it and we can meet it.
Excellent. Andy?
I certainly agree, Jen, with those comments, and would just add too that I think the extent to which we can embed bi-directional communication systems within the context of our PBIS framework, we're able to sort of live out, just what you described. And so if we actually build in these systems in the context, at Tier 1, all the way up to Tier 3, then we have, not just a point in time at which we're reaching out to families, but an ongoing dialogue, existing systems where educators and families can engage with each other in sort of live, in the moment, problem solving and discussion and strengths oriented actions together.
Terrific. Perhaps one more, Darian. We have just a couple minutes.
I think there was one more about how family checkup compares to wraparound in terms of use and training.
I think we covered that.
Yeah, that may be the last one, unless anyone else wants to put anything in the chat.
I think what I would add to that question about wraparound is just thinking of the family checkup as an additional service that can partner with all the other services that exist, rather than taking the place of it. And so that could apply to wraparound. It can apply to, I'm partnering with the school social worker, not replacing it, with the school counselor, not replacing them. Just I'm an additional friend on the team.
Great. Shall I close this out, Andy, or would you like to?
Go ahead, Mark.
Well, thank you, Jen, Andy, Darian, and Devin for this session. Thank you, Andy and Devin, for facilitating this strand. Thank you to the PBIS Center for the forum. It's been wonderful. And thank you all for participating. I hope it's a great end of your week and a terrific weekend. Best wishes.